what is excision? What is ablation? What's the difference when it comes to treating endometriosis? Ablation of endometriosis means applying heat or laser or anything else that doesn't remove it with the hope to treat that endometriotic lesion. Excision means cutting around the lesion, going beyond the lesion to reach normal tissue, and then cutting it away and sending it to be looked under the microscope. These are the two main surgical approaches to treatment of endometriosis. The problem with ablation is that endometriosis is often much deeper than it appears. That's why we use the iceberg analogy. What we see is the tip of the iceberg, and therefore applying heat or burning the tip of that iceberg does nothing to the rest of the endometriosis. And that's unfortunately what ablation does. Well, ablation is a much quicker operation. It requires much less skills and can be done by most gynecologists. Excision, on the other hand, is usually a much more difficult, challenging, longer procedure, and it requires special training. It requires a surgeon that is very familiar with the anatomy of the pelvic sidewall and the depth of the pelvis, and therefore is more challenging to do. We have another procedure called endometrial ablation, and that's a completely different procedure to endometriosis ablation, and that's very confusing. Endometrial ablation is a procedure done hysteroscopically, so there are no incisions involved, and it's a treatment for heavy menstrual bleeding. It has nothing to do with endometriosis. Endometrial ablation is actually quite a good operation, and it can be very helpful in many women who have abnormal uterine bleeding, particularly heavy menstrual bleeding. But it doesn't treat endometriosis at all. Endometriosis ablation is a laparoscopic procedure where the surgeon will apply heat or laser or helica or plasma jet to the endometriotic lesions.